I read another stat today, and it was from a conference last Thursday, and it went state by state and talked about since the unwinding. So during COVID, everybody raised the floor of opportunity where more and more people could be on Medicaid, right? And of course, we've expanded Medicaid, this, that, or the other. What we're talking about is the mechanism that provides that support for systems like Parkside and us, because the vast majority of clients we serve have Medicaid or no insurance.
Yes.
Are you similar boat?
Yeah, we're very similar.
And I saw the states color-coded based on how far enrollment has dropped in Medicaid right now. There's been such an unwinding, and Oklahoma is right up there. We're number one, tied, 25 to 30% reduction in people getting enrolled in Medicaid. I think there's a lot of things that go into that, certainly some of it unwinding. Eligibility is an important consideration, but we're also seeing things, like the transitions with managed care and so many other things that is just sort of swirling people up. And my fear right now is that as much as we're all agreeing that we've got to do something and show up and have these conversations, we also need sustainable ways of providing support and ensuring that the agencies are all able to do the things we're tasked with doing. And for my part, I'm a little worried about some of that happening both statewide and nationwide right now.
Yeah, it's so here's what I do know, Adam, is that most of the time we haven't done a good job of portraying our story, of helping the people that can make better decisions really understand that. When I got here, like I said, a little over 2 years ago, one of the truths, and I'm using the quotes because one of the truths I was told is that—
For listeners, he used air quotes.
Yeah, I used air quotes. You will never be able to get an increase in the base rates in Medicaid for psychiatric hospitalization. And I said, well, first off, I don't buy that. They said, no, it hasn't happened in 16 years. Let me say that again.
Was that dog years?
16 years, I wish. And so, you know what we did? We just took the books and laid them out about what it costs to take care of kids, specifically, the very best that we possibly can. And an amazing group of legislators worked really hard that year. And I couldn't even begin to list the shout-outs I would have to do. And between what was done through the state agencies and the pressure of the legislatures, we had the first increase in 16 years in Medicaid rates.
Because you were real.
We were real. I don't think the state's gone bankrupt. I think we're still okay.
That's what I'm hearing.
That increase helped us do a better job of taking care of people and taking care of the people that take care of people, which I know is very important to you as well. And so all that to say, we got to do a better job of getting our story out there of how we need support.
One of the pivots we're going to do, and again, I wish I could claim that I invented all these ideas, but I'm just finding them everywhere. And then,
That's good.
What do they say? Creativity is knowing how to conceal your sources.
That's exactly right.
In our marketing communications and in our outreach, we're going to emphasize less and less our number of services, because we've always been like, look, we've done this many services, but one of the ahas recently is that people, funders, lawmakers, if they think what they're funding is our ability to provide more services, and yet suicide's going up, all these things are going up, it's not really going to feel like money well spent. And we are spending right now nationwide more on behavioral health than we ever have. We're making a massive investment. Like in the last 30 years, there's been like $15.7 billion just in private equity pushed into behavioral health. I mean, it is just amazing. But the fear is that too much of that is going into number of services provided. And the pivot that we're going to start doing in our outreach, and I think would be a huge aha as a community, is if we really did pivot from number of services provided to people taken care of. How are we taking care of people? Because these funding sources, things like CCBHC, enhancements in inpatient rate, if we could really change that conversation to we've got to invest like this because that's how we take care of people, I think there's a lot of this that would make a lot more sense.
It is a mind shift that has to happen. I mean, I've got such an amazing board that supports me at Parkside. And when I was asked about my census one day, I had to explain to them what the census is. So the census is not how many people are in the hospital right now.
Right.
To me, the census is how many people came to our door that we weren't able to help that day and why. That's the census.
Yes.
If we would all attack it in that manner. So that changes everything, though, because no one thinks that way. And when you find a principle like that that feels good and you realize that no one else is doing it that way, you're probably doing it right.
And I don't want to artificially bring us around full circle to where we started. But when you think about zero suicide and the academy and the focus on young people, I feel like one of the biggest opportunities in front of us right now is, I mean, like we don't have to convince society to be against suicide, right? I think they're sort of against it.
Right.
But how do we invite people into that conversation and equip them with the resources and awareness so that they know how to help us, but we know also how to help them? Because I think that everybody agrees. It's like, who's for world peace? Raise your hand. We're all for it. We're all for zero suicide. But back to how we engage with the community, is there anything that we need to be doing or talking about that we're not as it relates to suicide, zero suicide, young people, all the groups being affected by that? Is there something we need to pull back around in this conversation to make sure that we don't just talk about all this, but there are some actions or things we can lean into?
Yeah, I think it's important for us to be very inclusive of the people in our community. On the Zero Suicide Academy, I know we're both have some extra seats at the academy, and so we have people coming from the Tulsa Police. I'm reading this: Tulsa Police Department, Tulsa Health Department, the city, Healthy Minds, Tulsa Girls Home, Tulsa Public Schools, Cherokee Nation.
It's great.
So
it's all these great partnerships.
Yeah,
it's like it's
it.
a community rallying around a similar idea of prevention and how to get those tools into people's hands.
That's it. It's a compelling story. It's something that, like you said, it's hard for anyone to not be wanting to be part of that.
Yeah.
But the mobilization, sometimes it takes those of us that aren't as scared of it, but understand it's a problem, to get out in front and help pull people with us. And I think those conversations are going to be great. We have to involve people in the work, though.
Yeah.
And so Tulsa's prime for this right now. Shame on us if we don't take advantage of this.
100%, because at the end of the day, I've never been in a community that is as all in this together, locked arms together. I don't feel like Family and Children's Services, and I know you don't feel like Parkside is out and fighting this on our own. I feel like this is a community that recognizes that we're all here to help, and we definitely have some of the things. We can bring some entrees to the table, right? We're not just bringing the silverware or the drinks. Like we're bringing some entrees with the services we do and the ways we can engage. But it does feel like a big potluck of people, whether it is civic agencies, Healthy Minds, first responders, the tribes. Everybody seems to be as connected as any community I've ever been a part of about doing this together.
Yeah, last Friday night I was able to attend the Oklahoma Academy celebration, policy celebration. And no less than a couple of dozen people came up to me and asked how things were going. They recognized that piece of it, that how important it is. And I'm not talking about people who are in healthcare. I'm talking about people who are in all walks of life that we've just run into or that have heard our message or have worked with us in some way to support us. But there's an interest and a desire to make things better. And I think that's what sets Tulsa about. Besides the fact that everybody here is just pretty nice.
They are pretty nice.
You know what I mean?
Yeah.
And then on top of that, you have people who really want to leave a better world.
Yeah.
And so let's help.
Yeah, it's a community helping each other in the community. And my big takeaway is get real as a provider, your kind of call to action. But also, the individuals wanting care, they have to get real about what they need to, about recognizing that it's okay to ask for help, that it's okay to get the help that they need, that there are people that are vulnerable and are out there willing to help them when they're most vulnerable.
I think that's an incredibly important point. And that's, again, one we do together because until it's cool for everybody to get mental health services, we still have work to do. And so stigma has dropped a lot, right? I mean, I've talked before. COVID made it okay to be anxious, and that actually was one pleasant byproducts of COVID is that it was okay to be anxious and get care. But there's still so many individuals who feel that stigma and that fear that we still have a lot of work to do, even as so much stigma has been broken down. Jim, I think you were going to say something on this too.
No, I completely agree. Let me give you an example of how we can work together. So We were supposed to go to a meeting. People from your place, people from my place, other places in town. We were supposed to go to a big meeting, and it got canceled. And instead, we went to a restaurant, and we talked. And we said, what's the biggest issue we've got trying to help our folks? And it was about access. It's so difficult, even as hard as we try. You guys do a lot of stuff. We do too, to try to make it easier for people to find us and to be able to access the system. We came up with the idea that the paperwork is so tedious, right?
Yeah, that is a barrier.
So you go to your place, you fill out all the paperwork, and then your person sees the client and says, whoops, we've got an intense problem here. We need to get you over to Parkside. They come to my house, and they got to fill out all the same paperwork. So
needs to be a systemic change
these
there.
groups, we're talking about 4 or 5 groups in town, sat down and said, let's do something about this. And over the course of time, we're working on the fact that next month, I think we're going to roll out a centralized intake process.
Oh, wow.
I love it.
And
so
so
exciting.
you can enter this room of care, this room of help, from many different doors, and you fill out the work, and it's going to cross over.
Interoperability. Who would have thought?
Who would have thought?
Right.
And it's happening right here. And this is something I think that people that get involved with us, that work with our agencies, that work with the things we're trying to do are going to be really proud of down the road. I think Tulsa can make a difference and show folks how to do it.
This is a great conversation, Jim. I'm hoping you'll come back and we do it again.
Absolutely.
It's
anytime.
been so fun being real with both of you. Thank you for joining us today.
Thank you for the invitation. I appreciate it.